Hello, everybody. My name is Dr. Shaheen Daju. I'm an orthodontist working in Los Angeles, Santa Barbara, Santa Jose area. And I'm excited to share with you a topic that is more and more affecting us and seeing in clinical practice every day. And that's the topic of temporomandibular disorder. And all too often, we have patients come to our office with TMJ problems, and we have few options to offer them besides surgical consultation. So my research, titled "The Potential Adjunct Therapies Used for the Management of Temporomandibular Disorders," is a study that reviews the index literature about alternative treatments to temporomandibular disorder. I hope that through this research, you'll find several ways that you can provide alternative treatments to your patients that are evidence-based and will help them manage their condition. Of course, I have no financial conflict to disclose. This paper is published and indexed on PubMed, so if you search my name, you'll be able to find it. It was published in the Journal of Cranio, Mandibular and Sleep Practice, which has an impact factor of 2.2. So temporomandibular disorder has pain of the joint and muscles, and its prevalence is quite common, 31% among the adult population and 11% for pediatric population. As an orthodontist, you will definitely run into people complaining of TMJ, TMD problems. Looking back in the history of this, we find a very storied history of TMD in America. Beginning with the first reports in 1887, the studies have become more and more advanced, going through 1909, where we described chewing problems, functional issues, and it was really revolutionized in the 1934 with an ENT physician. We call this the Costin era. In the 1960s and 70s, we learned more about the psychological influences of TMD disorders. And then in 1950s, we had more refined diagnostic ability to understand, leading all the way to the 1990s, where neuroscience had advanced and our understanding of deep pain had become quite advanced. Of course, there are associated risk factors with TMD and psychological access to psychological disturbances that also affect TMD and enhance TMD. So the aim of my study was really to review potential adjunct therapies, alternative treatments to TMD that could be offered to patients, inform them, educate them, and see what we can do in addition to conventional treatments. I reviewed all of the indexed literature that I could find, and using the original criteria studies of a clinical study or original studies, I really aimed to build a holistic overview of TMD and adjunctive treatments to TMD to help patients. This includes acupuncture and laser, dietary interventions like herbs, sprouts, vitamins, exercise, physical therapy, counseling, and splint therapy. This is what I found. With the potential role of acupuncture, we've found that there are no long-term studies, but in the short term, acupuncture seems to help patients with TMD. There were no studies that looked at the role of diet, vitamins, herbs, oils, or probiotics on the effect of TMD. And of course, we know TMD can be an inflammatory process, so having a low inflammatory diet may play a role, but there are no studies in the index literature that look at this. But the potential role of exercise also seems to show reduced acute pain of TMD. There are various exercises recommended in the literature that include manual therapy, isotonic jaw openings, head posture correction, and movements, coordination of the mandibular movements. Looking at massage therapy, again, we saw in the short term, helping acute pain of TMD, but no long-term follow-ups. And how about botulinum toxin? Very interesting topic. So the mechanism and action of botulinum toxin was reviewed, and you can see it's the snare proteins in the neurosynapse of the muscle that is paralyzed by the botulinum toxin. This is an original graphic that we've made and included in our study. Botulinum toxin or botox also showed in the short term helping patients with TMD muscle pain, but there are no long-term studies that looked at it. And of course, lastly, we have laser therapy as well, which showed in the short term improvement in TMD symptoms, but there are no long-term studies about it. As healthcare professionals, we have to be able to provide our patients all potential options It does not necessarily mean that alternative treatments are the end-all be-all, but it is an adjunct to conventional treatments. There are some promise to these treatments, and of course, we need more randomized controlled studies to look at these. I really appreciate the opportunity to discuss this interesting topic, and I thank you so much for listening. Thank you.